Welcome to another episode of the NEI podcast. I'm Dr. Sabrina Siegel with the Neuroscience Education Institute. In today's episode, we are coming to you from the 2023 NEI Synapse in Nashville, Tennessee. Today, we sit down with one of our incredible speakers in this special extended Q&A episode to give you a chance to get your unanswered questions addressed from selected presentations. In this episode of the NEI podcast, we are coming to you from Nashville at the 2023 NEI Synapse, and this is an exclusive extended Q&A episode where you will get a chance to have some of your unanswered questions addressed from Dr. Jade Wu's presentation today called Goodnight Mom, Sleep Issues During Pregnancy and Postpartum. Welcome, Dr. Wu.
Thanks for having me.
My first question for you is, should nightmares be treated in pregnancy with prazosin?
This is a great question because there's actually very little data on this, but there is some hot off the press data. 2023 study, a case series of 11 patients who took prazosin during pregnancy. And the study found that, about half of the subjects did not report any adverse outcomes. And there were some adverse outcomes, for example, 2 miscarriages, 1 postpartum hemorrhage, and a couple of other, preeclampsia, preterm birth. However, these rates were expected rates of complications, not above kind of unexposed folks during pregnancy. So this is some preliminary potentially, optimistic data that this is an option. However, I will say that prazosin is not even the first-line treatment for nightmares in non-pregnant populations anymore. It used to be before 2018, but there was a practice guideline change in 2018 that changed the first-line treatment to imagery rehearsal therapy for both trauma-related and non-trauma-related nightmares. So I would say, if possible, and I know this is a big if because a lot of patients don't have access to behavioral treatments like imagery rehearsal therapy for nightmares, but if possible, let's try the behavioral one first, just to be on the safe side, because we just don't have a lot of data on prazosin.
Okay, the next question for you is, can you safely also prescribe trazodone and diphenhydramine in the first and second trimester?
Yeah, so during my talk, I talked about this one study that showed that it was safe during third trimester. They did not study pregnant people during the first and second. And I would say it's a little bit hard to say because, again, there's not a lot of data. But there is another study with trazodone that's a multi-center, pretty large-scale study. And it found that trazodone does seem to be safe, at least not there were not any major adverse events, attributable to trazodone. And I believe the pregnant participants in the study included folks throughout pregnancy. So there is a little bit of data there showing that, some safety data. So that's good too. But again, there's just not so much data to share. Right.
So interesting. Hopefully the field will expand and we'll learn more in the future. Okay. So my next question for you is, do you have recommendations, lux amount for lamps to use when mothers ask about light therapy? So for example, what is the recommended minimum amount of lux for these light boxes?
Yeah, generally we go for 10,000 lux. So that's about equivalent to a sunny day. So this should be about a couple feet away, 2-3 feet away, at least arm's length away, from your eyes, and generally a little bit diagonally offset from your face. So you're not staring directly into the light, but passively getting the light into your eyes from the side, and for about 20 to 30 minutes.
Excellent. That's great. Thank you. The next question I have for you is, since we know that sleep is tied to longevity, how does the sleeplessness of the postpartum and pregnancy periods impact this? Essentially, how bad is the normal postpartum sleep disruption in the long term for women?
Yeah, this is a really interesting question. I think, first of all, we should say that it's just going to be really, really hard to tell because there are so many different parameters of sleep that are changing all the time. You know, sleep duration, sleep efficiency, the number of night awakenings, the number of apnea events, and, you know, all sorts of sleep. But we can look at sleep in so many different ways. So it's really hard to say the specific changes that happen during pregnancy and postpartum are those the ones that impact longevity, right? Because as we saw, sure, pregnancy has a lot of sleep disruption and total sleep duration does tend to go down at the end there. But sleep duration also goes up during first trimester. But then you know, excessively long sleep is all in the general population is also tied to, you know, greater mortality. But is that for the same reason? You know, are pregnant women excessively sleepy for the same reason as people who are non-pregnant? So it's just really, really hard to dissect all of this. But generally, I would tend towards thinking, you know, it certainly feels like forever when you're pregnant. It feels like, man, 40 weeks is a really long time. But in the grand scheme of things, it is not forever, right? It is temporary. And even postpartum, it's temporary. I showed data that, you know, by about 3 months postpartum, a lot of the sleep disruptions have abated to a great degree. And a lot of it hasn't, but it's, you know, sleep is very resilient. So unless we are, you know, looking at other barriers to sleep, whether that's on the individual level or on the societal level, pregnant women, postpartum moms, they should be able to recover to good sleep, not too long after they've had their babies. Not to say that sleep disruption is not important during this time, but I don't know that it's enough to affect longevity on such a large scale.
Well, that's very optimistic. That's very positive news to hear. I like hearing that.
I hope so. Yeah.
Okay, so our next question, because we talked a lot about caffeine half-life during your presentation, and this person asked, is caffeine half-life different in the postpartum period as well?
I have good news here too.
Okay.
Basically, immediately postpartum, your caffeine metabolism goes back to normal, goes back to your pre-pregnancy levels. So, you know, if you need to use a little more caffeine or you just really missed it during pregnancy, you can have it back. Just don't overdo it.
That's good. That's great news. So that takes me to our last question, which is, do we find women that need CPAP during pregnancy still need this after birth for obstructive sleep apnea?
Potentially, yes. So this one is not as clean of a thing as caffeine, where it's like, okay, you hang tough while you're pregnant and then afterwards you bounce back to normal immediately. That's not necessarily the case because for one, the anatomical changes that may have exacerbated or led to apnea during pregnancy don't immediately go away postpartum, right? Like often we look and feel pregnant for a while after we have our babies. You know, we still have more weight on, you know, our, you know, there are lots of, you know, anatomical changes like breast size, like especially if you are nursing, your breast size may increase even more than during pregnancy. And now they are, you know, even more heavily laden with milk a lot of the time. So now you may actually have more pressure on your airway. So it's not certain that postpartum, your need for CPAP or your need for some sort of treatment for pregnancy onset sleep apnea immediately goes away. And it's not just the anatomical changes. With hormones and with age too, things can change. So if we're not talking just about immediately postpartum, you know, when we eventually go through menopause, that's when women are suddenly much more likely to have sleep apnea again too. So, you know, there are changes throughout our lives that increase the possibility for sleep apnea. Pregnancy happens to be one of the major ones. Menopause is another major one, but there are others along the way too. So we kind of almost always have to be a little bit, you know, alert to the possibility of that, especially as we get older.
Okay. So a little less optimistic, but
yes. But fortunately, PAP treatments are getting better and less invasive all the time. There are just many more options now. It's not just CPAP. There are, auto-titrating PAPs. There are positional therapies. There are, there's Inspire, which I have no affiliation with, but I have seen good data and heard good anecdotes about success with that, where basically, they zap your tongue to keep your tongue, allow your tongue to have more muscle tone so it does not flop back and block your airway. There's, innovative things happening all the time. So I am optimistic that people will be able to access and stick with therapy more easily. Although there's no shame in needing some help from, a behavioral sleep medicine specialist like me who can help you stick to your CPAP or your other treatment.
Excellent. Well, thank you so much for sharing this great information with all of us. And thank you for being part of this exclusive extended Q&A episode here at Synapse.
Thank you so much for having me.
Thank you so much for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today.